So let's answer a few questions here. First of all, I've got Miss Kaylin. We have your question here. I'm going to answer it for you, okay? She said, "Hi, Shari. I got to lift my laptop up because the glare. I wanted to sit with the outdoors. So my son is 5 months old. Can't believe it already, 5 months, crazy. And a great little nurser, however, lately seems to have a more shallow latch on my right side. He presses my breast away as he nurses, and I'm constantly sore because of it. I know I have a fine supply on both sides, and we have tried different positions as well. Just seems like it seems to be becoming a habit. Any suggestions are greatly appreciated as always." Okay, so Kaylin, yeah. First of all, one thing that could cause the baby to have more of a shallow latch after not having that problem at all, well, a couple things, but first thing that's coming to my mind is that it could be that you just went through a growth spurt, and I don't know, I know you're right there, I can see you. So answer the question. If you think that lately in the past couple days or week, you feel like the baby's been nursing a lot more frequently, possibly a growth spurt that you didn't really notice because you have a good supply anyway. If there's a growth spurt, what happens is that after the growth spurt, from nursing the way you did and keeping up with the supply, the milk supply increases. And so the breast starts to have a much stronger and heavier letdown. And that heavier letdown can cause the baby to still to have a much more shallow latch, where they're not going deep onto the breast. It's a way to control the flow of milk a little bit, and to or the breast might be a little bit more full, maybe not noticeable to you, but to the baby, where if the breast is really full, the nipple could be stretched and a little more flattened, a little more difficult to pull out, and so the latch feels more shallow. So that could be one of the reasons why he's pulling away or not going deeply onto the breast. Could also be that the baby's a little distracted, that the baby's looking around a little bit more. Five months is just around that time when that starts to happen. 4 or 5 months, they can start looking at their scenery, with your nipple still in their mouth, and they're kind of pulling it. So if they're a little distracted, they could be not as focused and close to the breast. She's saying, "I think we did just go through a growth spurt." How did I know that? How did I know that? Yeah, that's probably what it is. That was my first thought when I read your question, was that most likely a heavier letdown and tenser areola, tenser nipple, tenser breast from a little bit more fullness. What you could do is just try nursing on one side, finish one side completely before switching to the other side. And let the baby continue to breastfeed. See if after you get mostly through that breast, the latch is getting better, if he'll actually go deeper onto the nipple as the breast starts to soften up and empties. That's one good way to do it. And that will also, you'll be breastfeeding a little bit uneven, so that you're draining one breast and then doing a little bit on the other side. And then the next feeding starting on the side you finished on, draining that breast. By doing that too, what you'll find is that the breast milk is going to start to drop down to exactly what the baby needs. So it's a good way to regulate to where you need it to be. Okay, hope that works for you. I think, and then also one more thing too is sometimes you need to hold the baby closer. Just kind of get into a position where the baby may be laying on top of you. Some laid back nursing would be a good idea, leaning back, laying the baby on top of you. Gravity will tend to bring the baby closer to the breast. If any of you guys are having that issue where you can't seem to get the baby close enough, usually it's because your hand is just not strong enough to hold the baby there, but gravity is very strong and will work. So that's a good way to do it. Who just asked me if I'm still in New Jersey? Yes, I am still in New Jersey. Abby?
Yep.
I saw that go by and I wanted to just say, yes, I am still in New Jersey. I've always been in New Jersey. I was born in New York. Yes, Abby. I was born in New York and moved to New Jersey when I was 6 months old, and I've never left. I love New Jersey. I mean, I love other places too, and I would love to live somewhere else some point in my life. But this last year we kind of waited out, and we were buying a new house. We're like, this is it. This is our chance to move. If we want to go somewhere else, now's the time to do it. Jade was starting high school. But in the end, family comes first. What can I say? Family comes first. My parents are here. Joe's parents are here. Our siblings are here, all the cousins. And we have a very close family. So we just couldn't leave as our parents are getting older. our kids are really close to their grandparents. We just couldn't pull everybody apart, and so we stay and we pay our taxes here in New Jersey, which suck.
We get to travel for work.
But we do get to travel for work. You're right. We do get to travel for work. Now I live in a part of New Jersey, like all the way west and north. We're in the mountains, and as you can see, I'm in the woods. Like literally, that's my backyard, and my front yard looks exactly the same, which you've seen from my office. But we're on this really nice street. We have neighbors. It's Joe's got his phone on. Okay, Joe.
What the heck?
I don't know what that was. That was me talking over there. Anyway, oh, you're in New York? Yeah.
Sound check.
Great. Okay. And Joe's always lived in New Jersey. He was born here, and his parents still live in the same house.
She said hi.
Same house. His mom's probably watching. Same house from when he was a little boy, when he was a baby. Amazing. Amazing. Not us. We've moved a few times. Okay. Next question. They're like, get on with it. Okay. You know, I never get sidetracked here. Okay. This is from, Kelly. Okay. Kelly's asking, I basically have 0 maternity leave at my job. That's very hard. I have to go back at 6 to 8 weeks. I'm having trouble navigating which breast pump to be getting as I need something for frequent use. There are too many options. Price isn't really a problem as it is actually 100% covered by insurance. Okay, so first of all, you know, that is super hard going back to work at 6 to 8 weeks. And you do need to take some measures in the meantime to get ready for that first day back, because I typically say to wait until 6 weeks to start even storing milk, which obviously you cannot do if you're going to have a little bit of a stash beforehand. One thing I'm going to say is that you need a pump. That if you're going to be away from your baby, especially that early on, and for many hours a day, you need something that's going to be able to pump both sides at the same time, that's going to simulate your baby as much as possible so that your milk supply is it stays good and you have no trouble getting enough milk for your baby each day, okay? Who knows what my answer is going to be on this? Does anybody want to chime in and tell her which pump I'm going to recommend to her? Because I could do it, but I know you can all do it too. There's one pump that I'm going to recommend over and over again because I helped design this pump, okay? It's not just because they pay me, it's because I love it, and because a lot of the features that went into this pump are ones that I told them this is what needs to be and this is the kind that you need to have. And the pump is, yep, even flow. You got it. Ding, 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 ding. Okay, even flow. All right. I've been working with the company for over 5 years. It's actually been longer because the first year we were working with them to design the pump. It wasn't even public at that point. It was behind the scenes. It was working with their engineers and their product development group to actually design this pump. I had it in prototype to say, hey, do this, do that. And so it's really, really the greatest one that I can actually review. Now, the other thing too is I've seen them all together. So I do a lot of demonstrations of all the different pumps lined up together to see what are the features on the different pumps, and I still have to say that I go with the Even Flow. Someone's saying the Spectra. Spectra's a good pump too. If I had to say another pump that I actually just recently looked at, has a lot of good features as well. A couple of things that I didn't like as much was the quality of the containers on that pump, and also the lack of the soft, I just happen to have one here, the soft flexible silicone flanges is a huge benefit to the Even Flow. So that's my favorite one. It's actually really inexpensive. Lots of people are getting their pumps through their insurance and they think, oh, well, if I'm getting it for free, then I might as well get one that's really expensive. That's not really the case. Just because it's more expensive doesn't mean it's better. So that's my first choice. And it also comes with both my classes, Simply Breastfeeding and Breast Pumps and Briefcases. And Kelly, yes, Kelly, you really need that Breast Pumps and Briefcases class. You should be watching that before you go back to work. And if you're going back that early, start watching it right away so that you have yourself ready to go, okay? So Cirilla is saying, my Even Flow is kind of loud and I'm not sure if it's working properly after so long with suction starts to go down. Okay, this actually, last week I was out in Ohio, actually with Even Flow, and I went over and I was working with the team. This was so great. I was working with their consumer service, like their customer service team, the call center over there. you know, it's the people, like, if you have a problem with your pump, you call in and you speak to them. Amazing group of women. I love them. It was so nice to actually see people behind the scenes who are answering your calls. And I totally get why the customer service is so good, because those ladies are on the phone with you. But we saw a couple calls come in just while I was there about not, let's see. Oh, there we go. Okay, I'm back. Tell me if you can see me. You did not miss the thrush conversation. I just talked too long, Nicole. I'll be getting to it. Okay. So anyway, we were talking about membranes, and those little membranes, I'm going to show you what I'm talking about. This, if you're losing suction on any, and this is not just specific to even flow. All pumps have something, either a membrane or a valve. It's this very little thin thing here, okay? That little membrane. That's one of the most important pieces on your pump. It's the smallest piece. It's the most fragile piece. It's the part that people don't even realize it's there. But it's the most important part to get suction to the breast, because the way this works is that little flap comes down like that and seals off the hole, so that when this is on here and air is sucking, it's not just sucking air from inside the bottle, the suction goes to the nipple. If that's open, okay, or if it's warped in any way, air is going to be sucking from the bottle and you're going to lose suction from the breast. It's very simple, okay? But these are like nipples on a bottle. They wear out over time. They're not meant to last. The even flow comes, and many of the pumps come with replacements right inside the box because you're supposed to replace them. How often? Usually we say every 2 to 3 months, but if you're using your pump frequently, then you might have to do it even more often. They're very cheap. You can find them in the stores, and I would just have replacements with you in your bag all the time, because if you're starting to lose suction, that's the first place to look, okay? The other thing too is you want to be really careful when you wash these little membranes. You don't want to stick bottle brushes, and that was the person on the phone. She was sticking a bottle brush through there, and so they were getting completely stretched out and warped. Same with valves on some of the pumps. If you put a bottle brush through, you're going to warp it, okay? So how many of you guys know you're supposed to like replace those parts and that you're cleaning it? You're taking it off. See, like a lot of times people don't even realize that this little thing comes off. That's supposed to be cleaned. It's not supposed to stay on there. That has to be cleaned. It gets yucky inside of there, okay, if you don't clean it. Yes, you guys know. Okay, good. I get a smart, educated audience. I know you guys all know this, but there's a lot of people who don't know this, so I'm going over it, okay? That little membrane, need to replace it, all right? But other than that, love this pump, all right? Multiple flange sizes, all those reasons. If you're curious, go to my Facebook page and just look through my videos. I talk about it all the time. Yeah, they're hard to get off on your medulla, Sandra. Yeah. If you're having trouble removing it, soak your parts, get like a basin, stick it in the sink, and then fill it with some hot, soapy, sudsy water, and just soak all your parts till that piece comes off, because it's really important to take that off each time to wash it, okay? What?
There's a question that came through.
Yeah, but I have a question here that I'm going to answer right now about thrush, because they're asking me, okay? And people did put them in beforehand, so I will get to some others. Let's see. Where is this thrush question? Okay, so Dana asked the question, can you pump and freeze milk while you and baby have thrush? Okay, so the answer is you can pump and store milk, except I wouldn't give it to the baby if you're being treated. Okay, so the milk that you pump and the milk that you store is actually going to have the candida or the thrush in it. So, and that's the kind of thing when you have thrush and you're being treated for thrush, the baby's being treated for thrush, it's something that you want to work to try to get rid of. And you can keep contaminating yourself. Giving the baby milk that you pumped when you had the thrush could start the infection all over again. So no, I wouldn't store milk because you can't use it. You would have to dump it out. I wouldn't give it back to the baby after treatment to reinfect yourself. In fact, when you do have thrush, you have to be, while you're doing all the treatments, whether it's medication or topical medication, whatever it is that you're doing, you would also want to make sure that you're really cleaning your pump parts after every single time, your bottles, your pacifiers, all the nipples, including also your bras, washing them in hot water, washing them after every single use. I would make sure that, and also if you're using disposable nursing pads, washing them frequently, changing them frequently, all those things, yeast is something that's not easy to get rid of. So how long after treatment for thrush is done should you wait before you start freezing milk? Within the first week after you've been treated, I would say if your symptoms have gone away, if you've started to feel better, I think at that point you're probably fine to start storing again. Even though you might be still taking medication or you're still finishing out your course of therapy, that's because you don't want it to come back, but it doesn't mean that the milk is still tainted with the thrush. So I think it's fine after about a week. Sometimes a little sooner, depends on what you're doing to treat it. It depends on how severe your infection is. Some people just have thrush on their nipples. Some people have thrush through the breast. And so depending on how strong the thrush is, that's how long it's going to take. You're welcome, Tia. Okay, fantastic. We don't get a lot of questions on thrush, but I thought that was a good one to answer here. Somebody asked a question here. What? It's the glare and my contacts on the glare. Not a good combination. Somebody asked a question about for common cold. This is Cassandra. So Cassandra, Cyrilla's asking, having a biopsy done on my left breast, should I still feed my son from my right, or should I use milk that I have stored? Okay, so you are the one, Cyrilla, did you ask the question about who asked what was the question that you asked, Cyrilla, that I just answered? I'm trying to remember the backstory here. Hold on a second. I just answered. Oh, you're the one with the pump. Okay, sorry, Cyrilla, I couldn't remember what question. So you're having a biopsy done on the left breast. Should I still feed my son from my right, or should I just use? Absolutely feed your baby from the right. What would be the reason? Anesthesia? Like what were you thinking of why not to feed on that side, on the other side? I would still feed on the other side. This actually goes right to the question that I was just about to answer about medications. You may get a lot of strange opinions from doctors, nurses, anesthesiologists, dentists, just about everybody who prescribes anything, telling you that you shouldn't be breastfeeding while taking medications and that you need to pump and dump and that the baby needs to go on formula and blah, 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 blah. Okay, most of that is not true. And in fact, most medications are fine to use while breastfeeding. And if you're not sure which ones you should be using or not, there are great resources for you to look up. One of them is one that a website and a hotline that I always send you guys to, which is infantrisk.com. They'll give you great information to tell them the drug you're taking. But I'm going to do an entire episode on medications and breastfeeding, okay? Because this is something that we need to talk about. It is coming up so often, like every single time I do a Q&A, every single time I come on with Jamie, every single time I talk to moms, it is always there, that question about what medications, do I have to pump and dump and why? And I just had some fillings. This came in this week. I just had some fillings done at the dentist, and the dentist told me to pump and dump because of the anesthetic that they gave me, that they injected into my gums. Is that okay? Is that true? And the answer is absolutely not. So there's a lot of reasons why that they'll say this, but it's not true. Okay, so I think we need a whole episode on that. And in fact, one of the exciting things that I want to announce, first time, drum roll. Okay, one of the exciting things that we're going to be doing coming up, okay, is we're going to be starting something new, and that's going to be me streaming live on the Even Flow Feeding Facebook page, okay? It's something called Let Love Flow Live, okay? Because they have a whole campaign for Let Love Flow. It's beautiful. If you haven't seen that, go over to Even Flow Feeding page and look at some of the little statements that people have done, the videos that they've created with people's stories of how they let love flow. Mine's coming up, I think this month or next month. It might be next month, okay? But it's fantastic, and I'll obviously repost when mine is posted there. But Let Love Flow is a campaign they've been working on all year, and we're going to be starting this probably in the next 2 weeks. It's going to be quick, 15, 20 minutes on their wall, but each one will have a topic that I'm going to do a little educational session, okay? A little topic on breastfeeding or pumping right there on their wall. We won't be doing, it is a beautiful campaign. I love it. So we'll be doing Let Love Love Flow Live, and I'll be letting my love flow to all of you with good education and information. We'll have topics that you can share, that you can go back, watch again, and I think it's going to be great. And what I would love is for you guys to send me your suggestions and ideas for topics, because we'll be doing this every single week. And of course, I want to hear from everybody. What do you want to hear about? Maybe we'll do one topic on mastitis, or 1 week on medications, or another week on lipase, or something like that. So I could go a little more in depth about the education. Okay? So hopefully you liked it. Do you guys like that? Do you guys like that? I want to see some hearts if you like that idea, because we're going to be starting that next week, and I'm super excited. I'm going to be streaming on a bunch of different places, so I'll have to give you a calendar and a schedule. Yes, so that you know where to watch. Okay. So, yes, medications. I knew it. Okay. So the medication question, actually, which I never even answered here, was for common cold. Cassandra was asking for common cold and cough. What is safe to take while nursing? So a lot of medication, and I'm not going to go into the actual medication that you should take, but a couple things to keep in mind. One is that, wherever you can do more natural remedies, way better. And I'm talking about like garlic, I'm talking about, hot teas, steam, for clearing out your nasal passages. Those kind of things are going to be better than taking medications. But sometimes you need to take medicines. And there's a few things I would always keep in mind while breastfeeding is when you have like a single drug in the medication, it's always better than when you have multiple drugs. Okay, so a cold remedy that's one single medication will be better than multiple medications combined together. The other thing to keep in mind is when you're taking decongestants like Sudafed or pseudoephedrine, those kind of decongestants, what they're doing is they're drying you up, right? But by drying up your nasal passages, okay, and whatnot, it's also drying up your milk. So it does work pretty effectively to dry up milk. Now, will that happen with one-time use of pseudoephedrine? Probably not too big of a deal, especially if you have a really good milk supply, or even if you're a little oversupplied. It'd probably be fine, just making sure that you stay hydrated. But if you use it long term, or if you use it for a longer period of time, it could have permanent effects on your milk supply. So really weigh that out. The risk of losing your milk supply over the benefit of making you feel a little bit better for the moment. Try some other things. So I would say we're going to save this for a full show. It's going to be one of our first ones that I'm going to talk about because what you say, yeah, there's so much mixed info out there, and unfortunately not all MDs know. I get most of my info from Kelly Mom, but not everything is on there. Yeah, Kelly Mom's a great resource for so many of these things, and also infant risk for the specific medication. I send people there a lot. You call their hotline, you tell them the drug that you were prescribed, and they will give you information directly to you. So a lot of it has to do with so many different things, like how old your baby is, your baby's weight, is the baby preterm, is the drug itself, is it an injectable? There's so many things that impact that. So we need to talk a lot about that. Too much for today, but we'll do an entire show on it. What's good weight gain? Yeah, that'll be a good one too. Okay. Somebody's sending me messages. Hold on, I have to get rid of this or it's going to distract me. Okay, there, got it. Okay. All right. Mastitis. Amy. Oh, what happened here? Hold on. Okay, I didn't lose you. Okay.
You also have one in the chat about it too.
About mastitis? Yeah. Okay, great. So, mastitis. Amy said, I'm fighting... Oh, isn't that funny? I'm answering Amy's question, and the person sending me a message was my sister at the exact moment. Her name is Amy too, so she must have heard me talking about her, even though I wasn't talking about her. This is a question from Amy, and as soon as I said Amy, my sister sent me a message, and that's her name. That's really funny. Side note, I get a little distracted. I look like I'm talking, and my voice isn't matching up, so... If that's happening, something's going on with my stream here. Anyway, tell me if you can't hear me, okay? I'm fighting my 3rd round of mastitis. Any tips on preventing from it happening would be great. My daughter is 15 months and nursing at nap and night, but has been doing this for months. So I'm not sure where this is coming from. Just had an abscess drained yesterday. Okay. So third round of mastitis and an abscess, Amy. Yeah, something's not good here. Okay. Sounds like you're only, what's going on?
Danny has 8 in the last 9 months.
Oh, eight rounds of mastitis in the last 9 months, Danny? Okay, Danny, any advice on recurring mastitis? 8 times. I have a great diet, drink lots of water, and started taking lecithin, but it's been awful. I've been enjoying nursing this time. Okay, so this is going to be a topic too. Write this down, Joe, okay? Because we need to talk about mastitis as well. Depending on the reason that this mastitis is happening, and I would say, is it one breast or both breasts? Because what can wind up happening is you can start getting a lot of recurring mastitis on one side versus the other. And when I see this happening and you've taken all the measures, like you're not wearing underwire bras or constrictive bras, you're nursing well from that side and draining the breast and keeping it empty, you're not over pumping or oversupplied, all those things lead to mastitis. The other thing too is, do you have any cracks in the nipple that are causing bacteria to enter the breast? Because not all mastitis is bacterial, okay? Mastitis is an inflammation of the breast, not necessarily an infection. So when you talk about, I've had mastitis 8 times, I have to ask more questions than that. Is it really mastitis or is it an engorgement, a lack of fully emptying that's causing the breast to become swollen, red, mild fever, not necessarily bacterial. So there's a lot of things that we kind of need to clarify with that. And if that's happening, I've had lots of patients or clients who, one breast it's just very infective. It just keeps on happening. And so they wind up letting one side dry up and just exclusively nursing on the other side. That's a question I'd want to ask Amy if she was live here with us. Her daughter's 15 months old. She's only nursing 2 times a day. Is one breast like a full producer where no matter what, even though you're not pumping or breastfeeding during the day, the breast is still making milk because of those 2 feedings a day. And what's happening is milk is becoming stagnant inside the breast, so it's causing pressure on the milk ducts, it's causing pressure on the breast tissue, and it's causing inflammation and leading to mastitis. That would be a cause. My best guess is it's hard to answer the question without knowing more, but figure out what's causing the mastitis. If you're really full, it may be time to let one side go. I've seen people do that. Just say, look, I've had an abscess. I've had breast infections. I'm taking all these antibiotics. This one breast is just, driving me nuts. It's just not working. You can breastfeed with just one breast. So anybody else had mastitis or know somebody who's suffering with a lot of mastitis? It seems to be a pretty common issue. And also mistreated quite often, because really you don't have to go straight to the antibiotics. I don't feel like I'm getting messages. I'm getting any... It could be that you all stopped posting to me. You're listening, but you're not saying anything. But I'm not getting any messages coming through. There we go. Okay, just finished my antibiotic today. Yeah, a lot of you guys are dealing with this. I think that's going to be one of our first shows. Write it down. Let's do it. All right. You want to do a show on mastitis? Let's do one because you guys need some information about this, how to treat it, how to diagnose it, how to prevent it. The prevalence of it, okay, and what does it actually mean? What does mastitis mean? Is it always an infection? When do you call the doctor? When do you know to take antibiotics? And when you take the antibiotics, what happens then? Can you breastfeed? Yes, you can. So 6 times in less than 6 months. Oh my goodness. Okay, I would say this is something we need to do. All right, so we will talk more about mastitis for sure. Definitely more about mastitis. All right, this is what I'm talking about. Write down these particular topics because look how many of you guys, as soon as I'm asking the question, all you guys have the same issue. Yeah. Okay. Number 1 reason that I see for mastitis is, oversupply. That means pumping in addition to feeding and making more milk than you need to. Underwire bras or constrictive bras. And putting off feedings, not frequently letting your baby feed on demand, trying to schedule your feedings more than you should, all those things are going to cause the breast to become engorged and then lead to an inflammation. But we will talk way more in depth. That's just, you know, tip of the iceberg there. All right? Yeah. Makes you really sick. You know, this is something we got to deal with because it can make you really sick. And in Amy's case here, was it Amy or was it, no, it was Danny who said she had an abscess. Abscess could be really painful and pretty dangerous and can actually make it so that you can't breastfeed on that side. It could dry up your milk completely. So obviously pretty severe. We need to handle that. Katie said, best uses for pumped frozen milk that has high lipase. My son won't drink it, but I don't want to toss it. What can you do with it? Well, you can add it to your coffee if you want to. Might not taste so good, especially with the lipase. Some things that you can do with the high lipase milk, maybe mix it into food. Yeah, I don't know if you can donate it when it's got the lipase. I'm not sure. You have to ask about that. I'm not sure if that's going to be an issue, but it is a good question. Call the milk banks and see if they'll take it. I would think that it would be fine because they're going to pasteurize the milk. They're going to mix it with other milk. There's nothing wrong with the milk. There's nothing wrong with the milk at all. Lipase is just an enzyme that helps to break down the fats in the milk. And so it's actually doing what it's supposed to do. It's how do you know when your milk has high lipase? You won't know if you're feeding directly to the baby because it won't happen then. It's when you store the milk. So either you're pumping and refrigerating it or you're pumping and you're freezing it. In both cases, what will wind up happening is that if you have a high lipase starts to digest the milk. So it's kind of pre-digesting it, which causes the milk to take on like a sour or soapy taste to it, okay? It smells, you can tell because it smells kind of fishy. Everybody describes it differently. Fishy, soapy, sour, okay? All those things. Most babies don't care. Some babies don't care, right? Some babies don't care. They'll drink it and there's nothing wrong. The milk's not bad. It's just that the lipase is starting to digest some of the fats. The lipase is in your milk to help the baby digest those fats when it actually drinks the milk. So some ways to prevent that would be to scald the milk right before freezing it or right before refrigerating it. So you pump it, you scald it quickly in a pan, and then you store it. And that usually, you lose some of the nutritional value. Absolutely. Any kind of heating or even freezing is going to lose some of the properties. I wouldn't say that it's the nutritional value as much as some of the antibodies and some of the immunity protecting qualities of breast milk. That seems to be more affected by freezing or scalding. Okay. It doesn't look any different. You're asking, oh wait, what'd you say? Does it look any different when it has lipase in it? No, it doesn't look any different. And you wouldn't even notice it when you first pump it out. You won't notice it, okay? Because think about it, like your body has no idea that you were going to someday in 2016 go get a pump and pump milk out of your body and put it into something called a refrigerator or a freezer, okay? That's just not how human beings evolved. We evolved thinking that our bodies think that our baby is going to go onto the breast, eat directly from the breast. You're never going to see the milk. And that's it, right? Just like every other mammal on earth. They don't even know they're making milk. They never see the milk, okay? Dogs, cats, cows, any of them feeding their young, they never see the milk. They're just feeding it. Now, as human beings, we go to work, we have other children that we're caring for, we want to pump sometimes and go out for a little while. So we do all these things that other, the deer in my backyard, they're not doing. They're just nursing. So we get to see the extent of what happens when you take lipase and someone who has high lipase, they wouldn't even know it, and now they go and they freeze their milk or they store it and it's affecting their milk, okay? So that's all it is, and it's totally fine. It's just one of those things. Why is some of the milk watery versus thick white color sometimes? Great question, Nicole. You're an RN? What kind of nurse are you, Nicole? I was a nurse. I'm a nurse. I'm still a nurse. I was a nurse. I was a lot of things. Yeah, but I used to work as a labor and delivery nurse many, many years ago. Loved it. Love to know what kind of nurse you are. Anyway, yeah, good question. Why is some milk watery versus thick white color? Because your milk changes throughout the day. It changes throughout the feeding. So the milk that comes out initially, especially first thing in the morning, when you're fuller, or anytime your breasts are fuller, is a higher water content. It's called foremilk, and so it's more watery. It's more like skim milk. The milk can be very watery looking. It can even take on a bluish color to it. It looks a little blue. And then what comes out after that milk, as you continue to pump or feed, is med surge. Okay, thanks, Nicole. I needed to know. Excellent. Love nurses. What comes out after the watery milk is hind milk, which is higher in fat, more calories, thicker, denser, and usually a more creamier consistency, a different color than the foremilk. And even when you go ahead and pump into a bottle, if you leave it there, you'll see it start to separate where the water and the fat separate, and that's totally fine. You just kind of swirl it back together and the milk comes back together again. But first thing in the morning, you might see more of that watery milk. Late in the afternoon, your milk supply may be lower, and this is where a lot of moms think that, what's the point? I'm not really making that much. Maybe it's not a great feeding. Maybe I should supplement this feeding. You may be making half the amount of milk, but even more calories, because the amount of fat and calories that are in that smaller amount of milk is higher. This is why breastfeeding is so different than feeding formula to a baby. It's not the same, because you can't always, it's always changing. And so what you feed at different times of the day, when your breasts are emptier, when your breasts are fuller, whether it's night, whether it's morning, whether you're sick or not sick, on hot days versus cold days, all those things are going to contribute to what you're actually feeding the baby. It may be higher water content. It may have more antibodies to the virus that you're experiencing. All of those things are happening, even though you don't know. All you're doing is feeding, okay? But the milk and your body is super smart, and it's being impacted, and it's taking care of your baby perfectly, okay? So that's why it can look like different colors. Joe's talking to me over here. He's motioning. I guess we have a question.
You had a question earlier.
Oh,
before
okay.
It disappears.
Okay, before it disappears. This is from Jessica. Jessica's watching. Okay. I have a 4-week-old. I am so confused as to how long she needs to feed at the breast for. She eats for 20 plus minutes on one side, sometimes taking an hour, and then sometimes once more, so she gets the other side. Help. She's been gaining 2 ounces a day. So weight gain isn't an issue. Yeah, I would say weight gain is not an issue. 2 ounces a day, ma'am. Okay, Jessica. That's a lot, okay? What I would expect the baby to be gaining is somewhere from like half an ounce to 1 ounce per day. Breastfeeding, half an ounce to 1 ounce. 2 ounces a day is a lot. Now, that doesn't mean that it's wrong, okay? Because some moms, as we just talked about, okay, just have a higher fat content to their milk. Totally fine. If the baby's gaining pretty fast because of that high fat content, and that's what you naturally do, no problem. Baby's gonna self-regulate and adjust, maybe gaining a lot right now, but may slow down a lot as they hit like 4 or 5 months, okay? So I just want you to I wanna keep that in mind for you, all right? Is that even though the baby's gaining a lot right now, if you see that like sharp like drop off where they're, hold on, okay, I'm back. If they slow down, that's where I don't want you to worry about it, okay? As far as how long the baby needs to feed at the breast, I never give that answer, because what does it tell you actually? That the baby sucked that long? Does it really tell me how much they ate in ounces? Do I really know how much your baby needs to eat in ounces? How much fat was in that ounce? How many calories was in that ounce? Look at the amount of fat you're obviously making in your breast milk compared to maybe somebody else. How long do they need to feed? Is it the night? Is it the day? So you get it. We're confused. But here's the answer to your confusion. You don't need to know. having a time limit on your feedings is not really the right way to do it. If the baby eats for 20 minutes on one side, sometimes taking an hour, I would say that's a long time. And most likely what's happening is you can tell the difference between the baby actually sucking to eat and sucking to suck, okay? Babies have a strong sucking reflex. They want to suck a lot. They eat and then they suck, okay? And for a lot of babies, they would like to be at the breast just 24 hours, okay? Like maybe you're asleep a little bit in between and then suck some more, okay? That's fine to do, but if you need a break, you need to know the difference between eating and sucking. And so listen to the baby. When the baby's eating, you can hear the baby swallowing. It's that sound when they suck and then they go, suck, suck, suck. How good am I at that? See, sounds like that. Okay, so you can really hear when the baby is swallowing milk. When the baby stops swallowing and all you're seeing is a lot of sucking, 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 and it's like that quick sucking, more like a pacifier, it's fine to keep the baby on the breast if you're comfortable, but you're saying help. So I'm assuming you want a little bit of a break. At that point, go ahead and take the baby off the breast. I would assume the baby is getting most of the food that they need in the first 15 minutes of feeding, sometimes less. And as the baby gets older, it gets quicker and quicker. They become more and more efficient, where your feedings really could take 5-10 minutes and the whole thing's over. Okay, so pay attention to the swallowing, pay attention to what the baby's actually eating versus sucking. And if you want to try pacifier, a baby that's gaining that kind of weight, sucking that well, I'm fine with that. And the sooner the better, because if you don't do it, there's a good chance the baby's never going to take a pacifier. And obviously your child has a very strong sucking desire and need. So I would say pacifier might be a good idea. 2 ounces a day sounds like you're doing really good. Better than great. But I don't want everybody else to think that your baby should be gaining 2 ounces a day, okay? This is why I always kind of give both sides of the story here. So, I know you got a lot more questions, but I need to go. All right, we got some stuff we got to do. We got some work to take care of. Post them to my wall and make sure you're getting notifications from me. Take these questions, post them up on even on this post that I just did, or recopy them. When I post again, I'm going to go live. We'll do it again this week, okay? We'll try to get in another one. If not, I will see you in LA. Make sure you got your notifications on so you don't miss out on all the fun this weekend. And I'll even try to do a little live stream, maybe in our fancy clothes at the gala on Thursday night with our first candle. Thank you. I appreciate you too. I'm so glad. Did everybody enjoy themselves today? Did you always learn something, right? I hope so. I hope you're learning a lot of good stuff. I hope you're learning stuff. Okay. Oh, you guys are the best. I love you so much. This is the best thing we can do together. You can tell, right? You know how much I love doing this. So keep sending your questions. Aw, yeah, it's wonderful. You're gonna make me cry now. Yeah, it makes me really happy. All I want to do is help moms. All I want to do is support moms and babies to reach their breastfeeding goals, whatever they are, whether they're breastfeeding, not breastfeeding, it doesn't matter. It's what they want to do, what she wants to do, what women want to do. And that's really my goal, is to make that a little bit easier. And hopefully just these little bits of information are making a huge difference. From your messages that you send, you make me cry. The private messages that you guys send me, telling me your stories, telling me how, this, whatever I told you, this or that, made a huge difference, that it's been able to help you reach your goals and breastfeed longer than you thought possible. I can't tell you what that means to me. So yeah, keep sending them. I love hearing from you. And send your topics. Don't forget to send your topics so that I can cover them in our Let Love Flow live new initiative weekly. Okay, we'll be doing some great teaching sessions. Okay, so everybody have a wonderful, wonderful, beautiful November afternoon and evening, and enjoy, and don't eat too much Halloween candy, or do, and just don't tell anybody. Love you guys. I'll see you later. Bye. Bye.